I don't need to go through the statistics for all of you. There are deep racial and ethnic health inequities that literally span from the cradle to the grave. At the beginning of the life cycle, we see health inequities playing out in terms of things like higher rates of infant mortality among many communities of color, African Americans, American Indians, Pacific Islanders, many Latino and Asian American subgroups. We see higher rates of low birth weight in some cases, which set a trajectory for poor health for many of these children. As we go across the life cycle, through childhood, through adolescence, going into adulthood, we see a higher burden of chronic disease and disability in many communities of color. And what's tragic here is that you could literally name diseases from A to Z, right? You could start with asthma, arthritis, then you could go into the B's. Can't think of a B example right now, but you could go into the C's, cancer, cardiovascular disease, diabetes, all of the chronic and infectious diseases that we know are disproportionately burdening communities of color, but they also hurt all of us, right? Because they are dragging down our healthcare systems, imposing burdens that frankly we're not well prepared to deal with. And as we think about the growing diversity of the US population, the fact that there are 4 states, majority, minority, the fact that by 2042, 1 out of every 2 people in the United States will be a person of color, it's clear that this ought to be unacceptable. We can't tolerate these deep health inequities. And then at the very end of the life cycle, shortened lifespans, premature mortality affecting communities of color, again, disproportionately. These are issues that hurt all of our communities. This is something that's obvious to all of you. But what I hope to convey this morning is that we bear the responsibility, along with our other professional colleagues, of helping to raise awareness of these inequities and sounding the alarm that just like these more frequent storms that we see, we can't allow ourselves to bury our heads in the sand. We've got to take active notice, be engaged, and fight for systems and policy changes that can undo these inequities.